Assalamu alaikum. My today's topic of discussion is how to do root cause analysis in exam for MRCOG. So most probably it will be a preparatory station, and you will be provided with a file or folder in which there will be complete information of a particular patient, and in the question you will be directed like you are the person who is going to investigate this mishap which has happened with this particular patient, and you will be provided with a clinical scenario. For example, let's assume that scenario is your patient was a primary gravida, she was a booked case, and there will be a record of whole antenatal visits, and then she is with you in labor, and there was a fetal distress. Emergency cesarean section was done, but the baby was a stillbirth. So you are the person who is going to investigate it, and you are the person who will make a report, and then you will give your action plan accordingly. So let's learn more. This will be the type of scenario. It can be any case of gynae, it can be any case of ops. First of all, it must be rather an incidence. So adverse incident reporting will be already done about it. So now what you will do in preparatory station, and what will you tell examiner at the next station. So now you are going to open your folder, and you will look through all the pages very carefully, and you will start from the top. You will notice what is the basic information of the patient which has provided to you, and what was the date, and what was the, most probably initially there will be dates, and there will be written that this patient came at this date. It was her data, and there will be any reports or investigation which will be done throughout the antenatal period. You will be provided with all sort of that information. So you will keep a record of your all the findings, and you will check whether there were any prenatal visits, and during the antenatal visits whether there were any complications, or it was a straight away uncomplicated pregnancy. If there were any complication, what were the measures which were done at that time during antenatal periods. So you will check your clinical care provision pathways side by side. What was her prenatal pathways, what were her antenatal pathways, what was the care which was provided at that time. Now you will come towards the incidence, and incidence is stillbirth has happened during labor. So you will check. Now you will be given detail according to their timings. For example, during labor this patient was booked at this date and this time, and then there will be a whole record according to the time. This patient was seen by this midwife, this patient was seen by that doctor, and CTG tracing at this time was like that, and then she was contracting, and when Syndocinon was given, when ARM was done, like that. So there will be a minute detail of each and everything who was involved in that care, and if there was any fetal distress, it was identified which was the type of CTG at that time. It was whether it was non-reactive or it was pathological, whether fetal blood sampling was done or not, whether consultant was informed or not, when patient was shifted to theatre, was theatre available at that time. Then you will go towards the detail of the theatre, detail of the shifting, and in theatre when anesthetist was informed, and who was there to operate the patient, whether all the procedures were done under right protocols with right competency level, and what information was given to patient, how information whether consent was taken properly or not. So you will take record of each and everything, and definitely in the scenario you will be able to pick some things which need improvements. So after doing all this, you are going through the chain of events, and you are making your notes. Then you are going to make a report. You will, because you have to discuss these steps with the examiner, so you are going to make a report. In report, first of all, you will give your suggestions. First of all, you will identify the persons who were involved in the care of this patient, what were their category. For example, there was a midwife, there was a coordinator, junior doctor, senior doctor, and consultant, and anesthetist. List of all the people who were involved in the care of this particular patient. And you will go and you will meet those persons, and you will take their statements, and you will take their statements with their signatures and with their designations. In the whole procedure, you are not going to blame any person, you are not going to fight with any person. It is not your task. What are you doing? You are actually collecting information. Now after making your report, you will come to some conclusions, and you are going to give your action plan. And whatever action plan you have made, for example, you have made action plan that we need to update the guidelines and protocol for care of primary gravida during labor, and we are going to update our care pathways, and we are going to update there must be training of the coordinator or midwife or certain doctor to promptly take actions accordingly, to inform the consultant accordingly. So whatever are your action plans, you are going to discuss it with the examiner, and you will give your time frame, like I am going to make my all the actions within these 2 to 3 months. You will give a time frame.